Health Choices and the Law is a co-production of the Twin Cities Medical Society, providing physician leadership for the health of our communities, and TPT's Minnesota Channel. Funding has been provided by these foundations and companies.
Barbie Levine and Sarah Lynn Newberger call Mendota Heights home. As a same-sex couple, it's particularly important for them to fill out health care directives, since they don't legally have a spouse who can make decisions for them. And that's where the differences end. Like many people, they lead healthy lives, and yet they've decided it's time for them to fill out health care directives.
I think really part of the impetus was a will, and part of it was thinking it's time to do these very grown-up things.
How's your day, Barbie? Good. It was fun.
We met each other 20 years ago, but we started dating in February of '95.
We moved into the house in March of '96.
And we had a ceremony in November of '96. I have one son who is now 25. He is a musher and lives in Alaska and owns a kennel of 70 dogs, raises those dogs and races those dogs, and has run in the Iditarod and the Yukon Quest.
We've been there for the start all three times. I'm the head of school at the Talmud Torah of St. Paul. I have direct responsibility for running a Jewish day school, kindergarten through 5th grade, and an afternoon Hebrew school, serving children from 2nd through 12th grade. I think education is actually a calling for me.
I work at the St. Paul Jewish Community Center, St. Paul JCC, and I am the Director of Adult Services. People always say, did you always know you wanted to work with older adults? Because I do a lot of work. And I really wanted to work with people in a community setting, so it didn't matter really the age range.
I understand you're interested in...
So have either of you guys ever had to deal with decision-making for a family member, a parent, sibling?
My sister was ill, and I was part of that she had to do some fast legal things before she went into surgery. So I was helping navigate through that. And that was really, it's interesting I didn't do anything after that incident. I think it shows you the power of denial, that I could go through that, watch my sister go through that, and come home and do nothing.
For many people, the first time they encounter a health care directive is when they visit an attorney to make out a will.
Hi, I'm Stuart.
Nice to meet you, Barbie Levine.
Barbie, nice to meet you.
Sarah Lynn Newberger.
Sarah Lynn, nice to meet you. Would you like to come back?
That'd be great. Thank you.
Come on.
Stuart Bear is an estate planning and elder law attorney at Chestnut Cambronne in Minneapolis.
I know you contacted me to talk about a will or a trust, but we'll get to that. It's just that as people are living longer, I just want to make sure that you have the right kind of documents in place that'd be beneficial from a financial as well as a healthcare perspective. And then we'll talk about traditional wills and trusts and taxes, and I'll get nosy and I'll look at your assets, okay?
All right.
So, do you have any legal documents in place now?
No, that's why we came to you.
I understand. Well, that's great, because that shortens it. There's nothing to review or...
We're starting from scratch.
Excellent. Perfect. Perfect. I think the way to look at estate planning is an ongoing process. That instead of trying to gauge and have a document that has all these what-ifs, let's just have a clear statement as to who can make decisions, and let's revisit this. I think really the good shelf life of any legal document is about 3 to 5 years. That's what keeps us sane, to say this is going to resonate today, it's going to make sense, and we're going to look at this on a regular basis.
Makes sense.
Well, let me tell you about, I think, probably the most important document in all of estate planning, and it's really grown up over the past 25 years. It's called a financial power of attorney document. Sometimes it's referred to as a durable power of attorney as well. What that would do is it would allow your named representatives, probably likely each of you, to step in and handle financial matters for the other person. The other kind of document I want to talk about is something that's often lumped together. Sometimes people call it a healthcare proxy or a healthcare power of attorney, or they call it a living will or an advance directive. I think we're all sort of talking about the same thing. And what I'm talking about is something, I'm just going to call it a healthcare directive document. It used to be that a number of years ago, these were newer documents, and I, as the attorney, had to really explain it and go deeper with it. Now, I think if I mentioned the name Terri Schiavo, I think you might have a frame of reference. She, remember, was the woman who was in the coma in Florida for, I think, 15 years. She entered the coma at age 27. So I think that shows that this document is really not just for seniors who we think would be most appropriate, but really people of any age. In the Terri Schiavo case, it involved two main substantive issues. One is who should make healthcare decisions for Terri, given her medical condition at the time. Should it have been her spouse or her parents? And the second is, what were her end-of-life decisions? What kind of care would she have wanted if she was able to communicate? So that's what the healthcare directive document allows one to do. It allows one to name representatives and then set forth end-of-life instructions.
So do we start out with templates for these different areas that we need? How do we proceed?
Great question. As a lawyer, I have a library of different documents, of templates that I can get you started. And I'm happy to be the scrivener and help write it up just the way that we want it to be written up.
For those who don't have an attorney or who would like to explore on their own, healthcare directives and a list of key points to consider are readily available online. Sandra Schellinger is on the National Faculty for Respecting Choices and is a member of the Allina Health Center for Healthcare Research and Innovation.
So at a minimum, you should have a healthcare directive that lists your healthcare agent and what you're willing to let them do for you on your behalf. So what are their roles and responsibilities? So that would be nice to have in the directive. There's also a section in most healthcare directives that allow you to describe things about you, your wishes, your preferences, your religious background, what's important to you, what's quality of life. So for instance, what is it that makes life worth living for you? Why do you get up every day? And if you couldn't have that, would your quality of life change? Would that impact the way that you would make choices about your care? You can also put details in there about if you were at the end of your life, what kind of care you would like, where you would like that care, who would you want to take care of you, your religious preferences, any rituals that you might have that are important to you, organ donation. So there's a lot of things that you can put in from a detailed perspective. It's optional in a healthcare directive. The thing that's not optional is that you need to fill out a healthcare agent. Your healthcare agent is someone that has to be an adult. They have to be 18 or older, someone that you trust, someone that has your similar values, and then they also need to be willing. So I've seen a lot of people fill out a healthcare directive and name someone and never tell that person. I've had instances where we've picked up the healthcare directive and called the healthcare agent, and they respond saying, "She did what? I'm what? And what does that mean?" So they need to understand that they're a willing and able participant, and that they also need to understand that they might at some point have to make decisions about life-sustaining treatment. So it's not all about end-of-life care. There are other things that a healthcare agent might need to decide: where you get care, like a nursing home, who your doctors might be, those types of things.
Barbie, in your mind's eye, if you are ill or disabled, incapacitated, who is it that would make healthcare decisions for you?
I would certainly feel comfortable with Sarah Lynn, and I'd probably want to pull in one of my sisters also to work in concert with her.
I see. So to work jointly. And let me ask you a close personal question. You get along with Barbie's sisters well and see kind of eye to eye on certain things? Good.
Yeah.
I think that model might be a good model as well, because I think sometimes, particularly for our partner or our spouse, it's very tough to make decisions, and there is a certain wisdom in having it a collective or a joint decision, and that way that people feel very comfortable that the decision that was arrived at in a very mutual way. But understand, under Minnesota law, it has to be a unanimous vote.
Oh, wow.
If you have two people and one says this and the other says that, it has to be unanimous.
Okay.
So of course you want people to get along.
Right.
If, for example, you had children and they can't agree on the color of the sky or anything like that, probably a bad decision
Right.
to name them both. They're not
Right.
going to figure it out.
Right.
So back to you.
Yes.
Who would you name then?
I could think of some people who would work.
Do you see Barbie as the primary person?
I
Just
would.
Barbie?
I would. I think that that would make sense to have you be the primary person in charge.
Right. We could have different ideas of what we'd want at end of life, but as long as we understand each other's and feel comfortable following through with them.
Excellent. Excellent.
Our joke is that if we have a bouquet of flowers in the house and like the first 3 flowers have wilted, Barbie says, "Bouquet's done, bye." And I'll say, "Oh, no, let's pick out the good ones, throw away the bad ones, pick out the good ones, wash them, cut them, and put them back in the vase again. Look, we can get 2 more weeks out of this, or another 3 days out of this bunch of flowers."
There's the difference.
And that's sort of the difference here as well. I think I'm willing to stick around a little longer than Barbie is. If I can think and eat, well, firstly, if I can think and communicate in some way, then I figure I'm still around. And if my body is sort of, not in such good shape, that's okay. And I think you have...
I would also, with that criteria, I would also. But I think I would make a decision much sooner than Sarah Lynn to say that this has been a good life and I don't need to live the end of my life at such a diminished capacity. And I think we have different places where that diminished capacity would kick in at.
That leads to making sure that your representative is a zealous advocate for you. Because unfortunately, you might encounter a hospital that may choose not to honor that statement. And even though the law says the hospital has to honor those documents, there may be some pushback that needs to happen. So you want to make sure that the document, first of all, is known, it's out there, it's easily accessible, and then ultimately that the person making decisions for you is going to use tact and finesse in order to accomplish your wishes. After all, they're your advocate.
And are there other things we should know about if there is pushback? Because we certainly know somebody who had an issue that the first thing they asked for was to see it.
Right.
And so I know this happens.
Right. I think that your remedy is always asking for a care conference.
Okay.
And that's what you're looking for in your representative, somebody who can respectfully get around the authority and move forward. Barbie, I want to talk to you specifically. I want to pick on you if I can. And I know, because something just jumped into my mind, and that is, you said you had a son who's 25?
I do have a son, Jacob.
Great. Jacob. So does Jacob have a power of attorney or a health care document in place?
No, he doesn't have any of that.
Something that's often overlooked is planning for our children, particularly when our children reach age 18. Because at that time, we as parents have no further access to medical records or healthcare decision-making. And so particularly as children are going off to college or are starting out living independently from mom and dad, it's critically important to have not only a financial power of attorney in place to handle financial matters, but also a healthcare directive document. And that healthcare document might also have some particular provisions about a HIPAA release.
Okay.
Allowing us as parents having access to medical information so we can make more informed choices and medical decisions.
That'd be a good thing for me to talk to him about. That's great. Thanks for bringing that up.
Good, good.
Working with an attorney is one way to get started on a healthcare directive. An advanced care planning facilitator can take the process to a whole new level.
Filling out a healthcare directive is not an easy thing. When we make decisions, we weigh it based upon a lot more than just a checkbox of, we can do a treatment because of this and you'll get this outcome. The outcomes that most of us think about mentally, but no one ever explores with us, are our goals and our values and our preferences, but we don't often share those because no one asks us about them.
What makes life most worth living to me? A person should answer that for now.
There are resources today across the Minnesota metropolitan area where all the health systems are actively engaged in improving the process around helping you complete your healthcare directive. And what they have done is invested time and money and resources to allow healthcare professionals become trained to actually help facilitate patients, families, and their loved ones into having a discussion around their treatment wishes.
Each group of 3 has got an observer, a patient, and a facilitator.
And their training is really not to tell you to do a treatment or not to do a treatment, but they're trained in skills to really objectively facilitate a better understanding between you and your healthcare agent so that both of you are on the same page, and then actually help you get it written down in a way that you feel reflects your goals, your wishes accurately.
And so having this discussion will really help to find out what she really wants.
The Goodall family, Father Ram, Mother Nina, and daughter Lisa, are meeting with their facilitator, Helen Jackson Lockett-L.
One question, have you chosen a healthcare agent?
First, we are each other's agent, and if things are different, then Lisa is our agent.
It's important to know what are their goals and their values and what they'd like. Have you had any experiences with family or friends who have experienced a serious loss or something suddenly that has happened?
My mother passed away 2 years ago. As a matter of May 2 would be 2 years. And she did not want to give anybody trouble and everything. Now in India, people don't plan, exactly like that, but family members almost know the desires of the person.
Okay.
She had a massive stroke. They went to the hospital and everything, and doctors were going to put her on ventilators and all that. She says, nope. She told my brother, I want to go home. They brought her home. She was there for 7 days before she passed away. They called all the family members from all over. We had a video things, and I watched her and everything, and the whole family was there, and she went in peace.
Okay.
One thing she did, now this is in our tradition, Jain tradition, here. This is called a peaceful death.
Okay.
First thing person does is detach. The detachment from all the worldly things. Also asking for the forgiveness from everyone, whether they are there or not. Whatever they knowingly or unknowingly, if they have given any hurt, or if they have misspoken, or if they have hurt their feelings and everything, ask for the forgiveness, and then they grant the forgiveness. And that's the part have stuck in me, that if I have the death, I will have that peaceful, so-called samadhi death, where you leave all the worries of the world here, and you don't take anything, grudges or anything with you. Because that's the way you came in, not knowing what you are bringing in, and that's the way you want to leave it. So that's my last wish would be that have a peaceful death, detachment, completely detachment from the things.
I think I wouldn't have known this. I mean, I know parts of what he would have wanted, based on the faith and the religion, but I wouldn't have known any of this. And to be in that situation, if it is that situation, I mean, I wouldn't have known every single detail of what he would have wanted. So this is like a blessing within a very hard topic, which I find very hard to talk about, but it's good.
You expressed that, that you wanted to go in peace. However, we have medical technology advanced so much that we can delay the whole process of death. Could you express your wishes? Would you want to be on a ventilator?
If doctors and agent agrees for temporarily ventilator, can be better, and then some, But on a long-term basis, I do not want any artificial means to keep me alive. And if there is no meaningful life living, outcome of this thing, then I do not want to.
And I really echo what he's saying. I believe in a similar way. So yeah, if it is long-term, don't want to be alive. I mean, kept alive.
People talk about living well, and what does living well mean to you?
Living well means that one thing, you can listen, you can see, you can think, and do not have a so-called physical pain, and you can do the things which you like to do and within the reasons according to your physical condition.
And how about you, Nina?
living will to me is living the life the way I want and enjoying every minute of it, especially my grandchildren. And I will, in the future, will get one more grandchild. I already have 2. So that's to me, I can do things that I love to do.
Okay. Lisa, now you have heard your parents' desire, and you have been chosen as the healthcare agent. Now, thank you for doing that, and you have heard their wishes. Are there any questions that you have in that regards?
For me, the scary part is the suddenness of something.
Okay.
And something serious happens, and they're hooked up, and that's really where I'm really focusing with them to make sure they tell me everything. I don't want to not, because I just can't imagine that decision of having to turn something off or on or any of that without knowing. So it makes me feel a lot better to know exactly what they want. And we were talking about this. Growing up with them, you know, I know as a family what they've taught us and their morals and what they like and what they want, but I don't know the details. And so to actually hear this thing, which doesn't, a lot of it doesn't surprise me 100% of what they would want out of life, but it's important to hear the details of it.
This is a beautiful gift for your family because, as she mentioned, it won't be as stressful because she will have heard your desire and know that that is your desire. So it's not something that she's doing on her own. And it's so important for all families to be able to really give that gift to their family. You mentioned that your son lives in another country, and have you spoken with him and informed him that Lisa would be the healthcare agent for you?
No, we are still in process of all that.
Oh, okay.
Yes, we will be
we haven't completed, so.
Okay.
Oh, you already told that. Well, we are going to talk, Skype him tomorrow, so
we are still in process of.
Yeah, because it's important if a healthcare agent is chosen that the rest of the family is aware of it, because many times one person will know and the rest of the family is unaware of what's happening. And if and when that time comes and that person has to make that decision, then it won't bring further confusion. So it's important for the entire family to be engaged and to be well informed of what is happening.
To have a broader conversation, that's where you can reach out to your provider or your advanced care planning facilitator. So they're great at being the neutral party to make sure that the conversation happens and helps to mediate in effect. So if you have that resource, take advantage of it.
I didn't always agree with my brothers and sisters. Okay.
Getting your healthcare directive to the right people is very important. So as you complete your healthcare directive, you should make copies for a lot of people. Your healthcare agent, make copies for as many of your family members as you can. Your provider or providers, so it could be your primary doctor. If you have specialists, you should make a copy also for them.
I think the worst place to keep the document is in your safe deposit box, where there's no access to it. Finally, 2 other things. One is keep a set of documents or a copy of the documents in the glove box of your motor vehicles. Studies have been done by senior organizations, and those studies have found that your motor vehicle may be used to transport you in the event of an emergency. And then also to keep one in your suitcase or your main carry-on bag.
So we have 4 or 5 or 12 copies of the health directives and put them in all kinds of places. What makes them binding?
The way that they're executed.
Okay.
You know, many times we hear the story of grandma had a healthcare directive document and the hospital chose not to follow it. A couple of things come to mind. First of all, good Minnesota grandma that we have, did she even let people know? Or did it live in her safe deposit box? So there's that. The second is was it properly executed? Meaning it needs to be signed and notarized, that's how we make it legal. Okay. Or it needs to be witnessed by 2 disinterested witnesses. Disinterested in the sense that they're not named as representatives, and they also don't work at a healthcare facility. Okay. So we'll be in touch.
Good.
Okay, great.
And I'll be sending off a drafted document.
All right,
okay?
terrific.
Wonderful. Sarah Lynn, thank you so much. Barbie, a pleasure. Thank you. Thank you. Have a great day.
Any good tidbits that you took away?
I think one of the things, and I hope I follow up on it, is that these are really living documents and that they really have to be reviewed.
And then, as Stuart recommended, putting it in the suitcase. I don't have it in my glove box yet, but I do have it in my suitcase.
Wow, Barbie?
No, I haven't.
Health Choices and the Law is a co-production of the Twin Cities Medical Society, providing physician leadership for the health of our communities, and TPT's Minnesota channel. Funding has been provided by these foundations and companies.